Bending the healthcare cost curve was an ongoing concern before the pandemic hit. Now, with so much upended by COVID-19, as the Financial Accountability Office laid out, can the province find a way forward? On that, can we welcome in Vancouver, British Columbia, André Picard, health reporter and columnist for the Globe and Mail. In Waterloo, Ontario, Rosalie Wyonch, health policy economist at the Howe Institute. And from Little Italy in Ontario's capital city, there's Sheila Block, senior economist at the Canadian Centre for Policy Alternatives. And it's great to see you three back on our airwaves again for, as we like to call it, an important and timely discussion in light of the FAO's report that just came out last week. Sheila, to you first. Let's just start broad strokes here. What story, in your view, is this report trying to tell?
I think this report is saying no matter how you slice and dice the numbers, this year's budget did not have the money required to do what the government has promised it would do in the budget.
Rosalie, how about to you?
I would say I agree. It really shows the level of the challenge that we're dealing with in terms of both increased costs, decreased revenues, and a lot of work that needs to be done in terms of fixing some of the gaps or problems that we had with the healthcare system originally. So I'd say it shows quite the challenge.
André, what's the story for you?
Well, very similar to the other two, sort of a constant fudging of the numbers when it comes to healthcare. And this has just really underscored it in a very graphic fashion, a big shortfall over a long period of time.
Well, no fudging in the numbers coming out of the Financial Accountability Office, to be sure, and we're going to do a deep dive here on one aspect of the report. We touched on this with Peter Weltman, but now we've got some numbers to back it up. So, Tony, I'm going to ask you to bring up a shot here of the diagnostic testing backlog now facing Ontario patients. And for those listening on podcast, I'll go into some detail here. If we go back to the beginning of the pandemic, that's March 2020, you can see on this chart there is very little backlog at all to speak of. But then as the pandemic takes root, the numbers really go up and up and up a lot. And today we're looking at a non-emergent diagnostic procedure backlog of 1.6 million procedures. And if the current rate continues, the FAO has got that estimated by September to be nearly 2.5 million backlogged procedures, which the FAO estimates could take 3.5 years at current spending rates to clear. That clearly is not acceptable, I would assume, to the people of Ontario. But André, let's just remind everybody what the FAO is talking about when they're referring to this kind of a backlog. The services that this would include, non-urgent diagnostic services, means what?
Well, mostly surgeries, so not urgent surgeries, but elective surgeries. So there have been, as the report says, millions of procedures delayed, put off, and we're going to have to catch up at some point. And the question is, how do we do it? We can't magically add doctors and nurses. Operating rooms were already full. We already had shortages of staffing. So this is a problem. And these numbers really underscore just how severe the problem is. But the solution is a lot less obvious.
And this chart actually is not even elective surgeries. This is just the diagnostic procedures, the biopsies and that kind of thing, which I mean, if you're somebody waiting for a diagnostic procedure right now, André, this can't give you a lot of comfort, I presume.
No, this is essentially, I should have stated that more clearly, the prep before the surgery. You have to be diagnosed, etc. So waiting for scans and things, no, it's a time where people are very worried. They don't know the results. They don't know what's going to happen. And this was a problem before COVID. We didn't have a big backlog, but it was sort of always trying to catch up. And it's just backlogged terribly. And again, it's not clear how the catching up will be done in any quick fashion.
Rosalie, could you give us your characterization of the significance of those numbers?
Certainly. Really, I think that the number of people waiting or tests that we haven't done sort of speaks for itself for this size. But what I'm more concerned about, and sort of echoing André, is that those numbers don't include the considerations for, do we have the capacity, do we have the staff to actually be able to deal with the backlog in the time that the FAO is projecting? Because they're assuming that hospitals can operate above capacity for that entire period. and we're thinking about 3 years. So my worry is that all of that delayed diagnostics will actually mean that once we do get to diagnosis and people reach treatment, their case might be more complex, which could come with health consequences for the patients, but also increased costs for the healthcare system. And so I suppose, though that number is somewhat alarming as it is, my worry is actually that it might be too optimistic in terms of how quickly we'll be able to deal with the backlog, and that it might not include added costs because we've not found something during that backlog.
Well, that raises an interesting question because, okay, Sheila, Peter Weltman, the Financial Accountability Officer, in my interview with him just before you guys came on, said that essentially the province is going to have to double the current spending it currently budgets in order to clear that backlog. Rosalie raises the issue that even if they did that, do we have enough doctors? Do we have enough nurses? Do we have enough OR capacity? Do we have enough diagnostic tools to be able to do it anyway? What can you tell us on that?
Well, I think there are a number of ways in which we can start to address this. One of which is we have internationally educated healthcare providers that we could, fast track into service in this kind of situation. And we have to really take a hard look and see what capital expenditures would need to be made, what kinds of investments do we need to make in more healthcare providers. And I think we really have to look at what we have done during the pandemic and step up in the same kinds of ways that we stepped up then. And I really think that we have faced decades of underinvestment in healthcare in Ontario. And as a result, the chickens are coming home to roost here. And I think we really have to take a hard look at what we need in the healthcare system and how we're going to pay for it.
Well, let's do another chart here. And this again is from the Financial Accountability Officer's just completed report from last week. And Rosalie, I'll get you to start on this one first because this chart really piqued your interest. And I'll ask Tony Burkar, who's directing today, to bring this up if he would. Healthcare program funding, and these are the areas that the FAO has identified as facing potentially significant funding decreases over the next decade. Operation of hospitals off almost 20%. Regional coordination operations support off almost 70%. Small hospital projects off almost 90%. Digital health down more than 40%. Home care down 3%. This is something that theoretically we're supposed to be relying on in our future in order to ensure our long-term care homes don't become overrun. 3% decrease in funding. Outbreaks and diseases more than 20% off. Child and youth mental health almost 15% off. Rosalie, what's the story you're seeing in those numbers?
Well, really, some of those are understandable. The decrease in small hospital projects is really being replaced by large hospital projects. But really, some of those, I suppose, are puzzling and possibly a little bit worrying for me for the future, just because when we're looking at sort of the gaps or the problems that we've identified during this pandemic and before, youth mental health, I would consider to be a bit of a concern considering all the disruption that children have gone through in the past year. Digital health is really a tool to reduce costs in the healthcare system and get people easier access. And we've made great strides in actually doing that over the last year. And so the reductions or these negative numbers in some of the areas that have been identified as priorities simply by the situation that we're in does sort of make me question if we are going to really learn the lessons that we should be learning from this pandemic, in terms of we need to think about how we deliver healthcare differently, and home and community care, mental health care are very much part of that. And though the government is investing in those areas, I wonder if we're missing the opportunity to really have a major paradigm shift in healthcare and really address some of those chronic issues that we've been seeing. And with that, I to move forward on those issues, I would expect that we need some investment in those areas, and digital health, outbreaks in disease, home care, and youth mental health, I would think are all areas of priority, particularly given recent experience.
Andre, just before I get you to weigh in, I should just remind everybody that this is potentially what the future looks like over the next decade if, as the FAO says, the government of Ontario doesn't fund healthcare to the tune of $60 billion. That's the gap right now between apparently what we need and what the government is budgeting. So if that $60 billion gap persists, those kinds of numbers are what we're going to be looking at over the next decade or so. What story do you think it tells?
Well, I think very similar to what Rosalie said, it seems to be a disconnect between reality and what's needed. You know, with the investment in mental health and home care and digital health, those seems like obvious priorities in the wake of COVID-19, and they seem to be being reduced. Some of it, again, as she mentioned, makes some sense. You know, there's a big reduction in I forget the exact category, but administration. And I think that's a shift to the Ontario Health Team. So some of it's understandable, but overall, some of it is very puzzling. You have to worry and wonder about government priorities.
Sheila, does it make you wonder as well?
I, I think this government's priorities are pretty clear. They are focused on the bottom line, and I think they're focused on the bottom line to the detriment of public services. And I think really what we want to drive home here is this report says, can the government fund what they said they're going to fund? I think there's a whole view on what they've said they're going to fund is not actually sufficient. You can look at the timing that they're going to take to get up to 4 hours of care in long-term care. You can look at the de-skilling of long-term care workers. You can look at what we're going to do with the real crisis that nurses are facing as a result of this pandemic and policy in response to it. And you can even think about the legal challenges about nurses' remuneration. And if the government loses those legal challenges, then they will be even further behind in the funding of what they want to do.
Well, Andre, let me play devil's advocate for a second and say what the government probably would say if the Minister of Health were participating in this discussion, and that is, look, we're spending north of $70 billion annually on healthcare in Ontario right now as it is. Surely, she might argue, that's enough to deal with all of the priorities we have. What's the response to that?
Well, maybe it's enough, but I think we don't spend enough time thinking about, are we spending appropriately? Are we getting value for money? So it's not just about doing more of the same old, which tends to be the way that government budgets operate. Is we've spent X billion last year, we're going to add 2.2%, and that's that. So there's never been, and there rarely is, a fundamental rethinking of how we spend and where we spend. And that, again, is, I think, an opportunity that COVID-19 should have given us, is to really rethink, are we investing properly in elders, in home care, in mental health? And this seems to underscore that we're actually not really thinking about this at all. We're just talking about just the numbers. Can we hold the line? And it, I think, raises really serious questions about how will the government, if it feels it's spent enough, how will it control spending? Because in the past, how have they done it? They've frozen the payments to hospitals. They've tried to control doctors' salaries. They've cut back on nurses and pay to nurses. All these things have been monumental failures. So if the government line is we have to spend no more than this, well, tell us how you're going to do it is the most important discussion, I think.
Sheila, let me pick up on one aspect of Andre's answer there and put it to you, and that is that every healthcare expert that we talk to, and Andre wrote about this in his most recent book as well, every expert says older people want to age in their homes as opposed to hooked up to tubes and lines in a hospital bed. And the way to make that happen is to increase funding for home care, perhaps, but not necessarily at the expense of more money to hospital care or long-term care. The expression we hear all the time is we don't want to warehouse seniors. We want them to age appropriately in their homes. When you look at that chart and when you look at the priorities that the Ontario government has enunciated so far, do you see that approach being put into effect?
I don't see that approach being put into effect. And I think we have to not only look at that approach as a way to reduce healthcare costs, but I think we have to look at it as how do we enhance the quality of life. And I don't think that, an immediate kind of removal of money from hospitals or reduction in long-term care and reinvestment into home care is really the way to do this. I think what we need to do is increase investment in all of these sectors, and then we can kind of take a look at it and see how are we increasing the quality of life. And there will absolutely be some positive outcomes. We know that many seniors are in hospital waiting for either home care or long-term care. But I think the objective really should be quality of care and quality of life.
Rosalie, do the numbers that we've just put forward suggest to you that the government seems committed to improving the home care budgets, improving the long-term care budgets, and so on?
Well, I think that they've made commitments, especially because of the results we've seen, the public demands that we really do something about the situation that occurred in long-term care homes. But really what I think when we're talking about all of this investment, and I agree that there are issues that all of these issues need to be dealt with, but at the end of the day, we already have a gap in what's promised, sort of what we already have on the table already looks somewhat unaffordable. And then with the FAO projections looking out 10 years, the gap between what the government projects and what the FAO projects is equivalent to almost the entire post-secondary budget. So we can't invest everywhere in healthcare. We can't just keep spending more there. What we need to do is be incredibly strategic about where and how we spend that money. And otherwise, healthcare seriously runs the risk over the long term of crowding out other program spending or quite significantly increasing taxes. And so though we can talk about what we would like to do in an ideal world with all the resources available, there really is the unfortunate fact that government revenues have also taken a hit, and that investing in one place means that you can't invest somewhere else. And though we do need to invest in our healthcare system, I worry that if we focus too much in one area, we will neglect all the other areas of program spending, public services, that really, it's the collection of all of these programs that contribute to people's health and quality of life and, keep them well. And so I think we don't want to invest in sick care if it at the expense of crowding out, preventative care and high quality social determinants of health. So thinking about welfare, education, and really there isn't an infinite amount of money. And so we do need to be strategic, but at the same time, we have quite large priorities that will be expensive. So I'm sympathetic to the idea that this is an incredibly difficult challenge, but that just choosing where to spend the money won't be enough. We need to think differently about how we're going to spend the money so that we can actually afford high quality care for everyone.
Well, in fact, I've been hearing health ministers across the country talking that way for the last 3.5 or 4 decades. And André, maybe I'll get you to weigh in on this. I've been told, well, we've all heard over and over again that the healthcare system really has to stop singularly focusing on being a sickness treatment system and has to start encompassing ideas of health promotion and wellness promotion. Are we doing that yet adequately in your view?
Well, the short answer is no, we're not anywhere close to doing that. And I think what Rosalie said is really important. We have to be careful to not just say we're going to keep spending on sickness care over and over. We've seen this particularly in Ontario in the past. What they've done is, slash welfare budgets, housing, public housing support, et cetera, things that keep people healthy in the first place. And that is a losing proposition in the long run. So we have to be careful to find that balance. It's true that money isn't unlimited, so we have to make choices. And I think one of the most important policy discussions we need to have in Canada, and we've been putting it off for decades, is, well, what do we cover publicly and what do we cover, what must be covered privately? And people don't like to hear that word, but we have a lot of private funding in Canada now. We just don't necessarily do it in any coherent fashion. It's not clear what's covered or why, and we have to have those discussions more broadly and openly.
Well, and different provinces, Sheila, cover different things, and that kicks off, I think, a little conversation I'd like to have here about comparing and contrasting Ontario with some of the other provinces. And let's start, for argument's sake, with Quebec. We noticed that Quebec ramped up spending and training to create more personal support workers after the first wave. And Ontario eventually brought out a similar policy in which they offered to subsidize the education to create a whole new generation of personal support workers in the third wave. Why were we apparently so late to get on that train?
Well, that is a devastating question. And I think there's a real question when governments realize they've made an error and move to correct it, and governments who don't. And I think the clear policy that the government has had through the pandemic, and particularly in long-term care, is their response was to kind of loosen regulations and to leave wide room for providers to move through them. And for example, BC very early on said you can't move from one home to the other. Ontario said the same thing, except they said if you're a temporary worker, you can move from one home to another. And
You're
as a result,
about PSWs in one home only.
PSWs in one home only. And so that those kinds of policy responses from the Ford government have very much so cost lives. And I cannot give you a policy reason why they did that. It's truly distressing, and I think the Long-Term Care Commission kind of laid that out very clearly.
André, maybe I'll get you to make another comparison between Ontario and the province of Quebec. Quebec has what they call the Ministry of Health and Social Services. We don't. We are only the Ministry of Health in Ontario. Now, maybe that's important or maybe it's not. You tell me.
I think it's symbolically important. I think, in Quebec, the Ministry of Health is dominant, much more than the social services. But I think they understand better that these things are linked, that, making sure community clinics offer welfare services. A good example I like to use in Quebec, they have a program where if you go to your local community health center called CLSCs in Quebec, a pregnant woman will be prescribed orange juice and milk and prenatal vitamins. So this is an integration of this. Let's keep people healthy to ensure they don't have low birth weight babies. So that's just an example. If you have more integration, you have smarter policies. But Quebec isn't magically better, but on that count, I think they are a little more thoughtful, and they realize that this is a whole continuum that's not just about sickness care, it's about taking care of people, ensuring they're healthy in the first place.
All right, Rosalie, let's do another bit of comparing and contrasting here. How about hospital beds? The number of hospital beds per capita in the province of Ontario, say, compared to the other either 9 provinces, or if you want to include the territories too, how are we doing?
Well, Ontario is a little bit below the Canadian average, and unfortunately Canada is, doesn't fare that well on an international comparison either. And so I would say there are, relative to the size of the population, there are generally a shortage of hospital beds everywhere in the country, but as well, Ontario is a little bit below that average. And so there is it just shows the situation that we were in going into this pandemic, that there were, potentially not enough hospital beds for the size of the population. There was a large wait list for long-term care. And so I think just really, as Sheila said earlier, the underinvestment and the chickens coming home to roost, it's simply that you can't create that capacity overnight. And as a result, you end up with a lower capacity, less ability to maintain elective surgeries. And so really it just results in the situation that we're in now, which is that tough problem of we need more beds, we need investment in home care, we need to address the situation in long-term care. And meanwhile, there still is, we've been spending at an almost fiscally unsustainable rate, yet we still have these issues. So we've just really been digging a hole, and COVID just really sped up our say, downward trajectory. And now that's where we are, and we need to figure a way out of it.
Well, you've nicely set the, yeah, sorry, Sheila, you wanted to add something?
I just want to leap in that absolutely we don't want to invest in healthcare at the expense of other services, and in particular in the social determinants of health. But I think we really have to be clear that there are fiscal options available, and that includes increasing taxes. That includes some renegotiation with the federal government if we're willing to kind of meet some of those long-term care standards that have been spoken about. And so I think really the lesson from this pandemic is we need a shift to a greater amount of economic activity in the public sector, and in particular in the caring economy. And it's not an infinite amount of need, and there are resources in the richest province that we could actually put towards them.
Well, you anticipated exactly where I wanted to go next in our remaining moments here. No, that's perfect, because this is exactly the question. I was going to say, you know, for those of us old enough to remember the old game show, this is the $64,000 question, but apropos of what the FAO has just said, no, this is the $61 billion question, which is if we're going to deal with that gap in what the government wants to do and what it apparently has been prepared to fund, we got to figure out either how to find $60 billion or reduce other programs by that amount, or borrow more or tax more, or what. And I want some advice from all of you on that. Okay, Andre, we know what the options are. What's the way to go?
Well, the way to go is we have to recognize that we want a certain level of services, a certain quality of life, and we're going to pay for it. So we have to figure out the way to pay for it most efficiently. And the way to do that often is with collective programs. So let's find the public programs that are most efficient, that give us the biggest bang for the buck, and invest well there. And then there has to be a portion that is left to people funding privately, either with private insurance or out of pocket. But we have to find that right mix to be. Either we pay from the left pocket privately or from the right pocket publicly, but we have to find the perfect blend to get value for money and to give people good quality of life.
Now, Rosalie, I cannot imagine that a representative of the C.D. Howe Institute, which is a business-friendly think tank, I think we can say that, I can't imagine you're going to agree to $60 billion in corporate tax increases in order to fund this gap. Or are you going to surprise me today and say, yes, you are?
Well, I would point out that the corporate income tax take in Ontario was a little under $12 billion last year. So it would need to be not a small increase to cover the gap between the projections or the total amount. And so I think that it would be, shall we say, optimistically, it would be very distortionary, likely, if we were to just fully fund that amount with taxes. And I would say, even if we were to do that, there would still be the concern about healthcare spending growing faster than the revenue base or the our GDP, and that at the end of the day, whatever the level of spending we have on our healthcare system, we have to ensure that it is fiscally sustainable, or we'll just simply find ourselves in another tough situation down the road. And so I think that there's
let me jump in here, because I got a minute. Forgive me, Rosalie, I got a minute left here, and I want to make sure Sheila gets a chance to respond to what you said. And I'm going to put the opposite question to you, Sheila. Are you really prepared to stick business with $60 billion in new taxes to pay for this at a time when so many businesses, not Amazon, but others, not Walmart, not Costco, but others, are having such a difficult time right now staying afloat?
Well, I think it's it's kind of a disputed question. I think what we can absolutely say is we would phase in these tax increases. We have to remember that right now, the cost of government borrowing is at historic lows. We do not have to pay all of this upfront immediately. A phased increase in taxes, absolutely all of it is not going to be on corporate income taxes, is the way to do it. And we would want to balance that with economic recovery, and absolutely it's doable.
I want to thank our three finance ministers for coming on the show tonight and explaining how this is all going to get done. André Picard, Rosalie Wyonch, Sheila Block, it's great of all of you to spend so much time with us on TVO tonight. Thanks so much.
Thanks for having us.
Thank you.
Thanks.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.